Hi there, Jess Sherman here. I wanted to shoot a little video on the topic of some of the research that's coming out linking the health of your child later in life right back to the method of their birth, whether they were born via C-section or born vaginally. The research I've had my eye on is quite compelling, showing us that in fact, children born via C-section have an increased risk of developing certain illnesses, including diabetes type 1, obesity, asthma, allergy, ADHD, autism, and celiac disease. Now, some of these research studies are showing quite a sort of a lower percentage of increased risk, something like between 4 and 10% increased risk. Some of them are showing up to 70 to 80% increased risk. A new review just came out in the British Medical Journal that's a nice synopsis of all of this information and links to some of the studies as well. One of the things this review study points out is that there does seem to be a lot of information, a lot of data being gathered that children born via C-section have an increased risk of disease. And yet this information hasn't yet trickled down and made it into clinical guidelines. So I think it's important for us parents to know. A lot of the studies don't come out and say that they know exactly why they have this increased risk, but many of them are pointing to the gut microbiome and pointing to the idea that when a child comes out vaginally, they pick up their mother's microflora, and that kickstarts their metabolism, their immune function, their digestive system. And that when you get taken out by a C-section, you miss that. And so some studies have shown that children born via C-section have an increased level of streptococci bacteria and a decreased level of the protective lactobacilli and bifidobacteria bacteria. And this might explain why the increase of these illnesses. So we're still at the point with this research where we have to kind of connect the dots. It's very hard to say, a 12-year-old's level of health is directly related back to their birth because there's so many factors involved. So it's very difficult to say, cause and effect relationship. But some of the information about the microbiome does really make sense. And it gives us some tools, right? Because C-section, sometimes it has to happen. My first child was a C-section, and maybe now I would make some different decisions, but back then, after 15 hours of labor and things weren't progressing, we opted for a C-section. Now with this information about the microbiome and the differences in the microbiome of a C-section baby and of a vaginal baby, that gives us some strategies to work with. So if you have to have a C-section, talk to your doctor about doing a vaginal swab. So this is just a protocol that is starting to emerge on taking a swab of the vaginal canal and inoculating the baby with that bacteria. Talk to your doctor about that. Skin to skin is very important as well because you've got microbes all over your skin. So that's another way that you're going to pass the microbes onto these bacteria onto your baby. And then up to the breast is also very important. The colostrum and the breast milk is a third way that you're going to be inoculating your baby with this good bacteria, which is really important. It just kickstarts everything. And then, later on, you can start to think about a probiotic for baby to get that lactobacilli and that bifidobacteria in there. Lactobacilli is really important to help digest lactose, which is the main component, one of the main components of breast milk. So without that lactobacilli, a child is at an increased risk for not tolerating the breast milk very well. And it's also really important for colonizing the bacteria. So all of this great bacteria is coming in. It needs to adhere to the gut lining and really colonize there. And the lactobacilli bacteria is really important for that. So you can get that through a probiotic. And bifidobacteria actually directly nourishes the gut lining. So that's really important as well. Most infant probiotics have a combination of the lactobacilli and the bifidobacteria. So that's what you're going to look for. And then when you get into feeding solids, you can pay close attention to the prebiotic foods and the probiotic foods to help colonize that gut even more. Up to age 2, things are kind of loosey-goosey and flexible in terms of the microbiome. So that's a great window of opportunity to really get those great strains in there and colonized well. After about age 2, things seem to kind of settle and not be so changeable. So that's a really important window. If your child's a little bit older and they had a C-section, and we didn't even know this information, gosh, 5 years ago. So don't freak out, because just understand that it's a bit of a red flag. The different digestive flora might be the root cause of some of what you're seeing in your older child. And it's never too late to take steps to support that gut microbiome, to increase the probiotics, increase the probiotic foods, increase the prebiotic foods, look for food sensitivities. All of that's so C-section is just a red flag for the older children. And again, going back to digestive support is what you want to do. Okay, so that's it for now. I'm Jess Sherman. I hope that helps you out. Have a great day.